Before I actually start talking about the pandemic and the Rohingya, I would like actually to give a little bit of a historical context about the Rohingya refugee crisis. So, first of all, just to go over a little bit the demographics, who are the Rohingya? Who is this population? It is actually predominantly Muslim. They live in actually a country called Myanmar in South East Asia. There are about 1.1 million living in Myanmar, which is basically 4% of the Myanmar's 55 million population. However, the living conditions actually for this refugee population in particular, they live on Rakhine in one of the poorest states with ghetto-like camps. How did the crisis begin? After a military coup in 1962, the Rohingya were actually granted foreign identity cards, which limited the jobs they can actually obtain or work at. Under new citizenship regulations in the 1970s, many of these refugees were actually forced to flee to countries like Bangladesh and Malaysia. Further and further restrictions were placed among them. They weren't recognized as citizens, and there were lack of documentation to prove their citizenship. Ethnic cleansing, expulsion, imprisonment, and killing by the dominant culture, by members of the dominant culture, were executed in order to achieve ethnic homogeneity. The living conditions. This population before the pandemic used actually to fight with each other in order to obtain the basic necessities. They are, before the global pandemic, they were at the risk of having cholera, tuberculosis, because of the lack of proper sanitary facilities. And according to Dr. Kate White, Doctors Without Borders medical emergency manager, the refugee camp is located on a piece of land, and everyone's into a small piece of land, and everyone is condensed into it. She said, "We just cannot scale up enough." How has UN response been to this refugee crisis? They have been actually working with multiple humanitarian partners and the government to share access to displacement sites before the pandemic. But the problem is that it is difficult to reach these services in a timely manner because it is located on a terrainy hill. According to International Organization for Migration. In December 2019, the International Court of Justice accused the Myanmar government of genocide against Rohingya Muslims. The president of Myanmar was actually presented by the Nobel Peace Prize in 1991. However, this actually did not stop genocide against this population. During the court, it was hard for this political leader to actually justify the actions of her country. So she engaged in a rhetoric that is able to identify and describe the denial strategies of a prosecution by maintaining a positive group image to support her standpoint. The findings here show that the president of Myanmar engaged in interpretive denial of genocide by arguing that genocide cannot occur when there is armed conflict, and that there were victims and the preparators on both sides. and the misconducts by law enforcement had been addressed. To maintain the Myanmar's government positive image, the president of Myanmar portrayed Myanmar's efforts in support for peace and justice by examining a political discourse used by this national leader for supporting human rights. So the key message was dynamic, constructive nature of denial in theory and in applied contributions to understanding denial of any group wrongdoings are being discussed here. As we mentioned before, this group of people are highly prosecuted in Myanmar at a scale that we cannot even imagine. The horrifying violence, including widespread reports of murder and rape, has left the international reputation of Myanmar in tatters, and the international community sees Myanmar as facing genocide charges at the United Nations Top Court. Just to examine the anti-Muslim rhetoric against this population, there were statements made by leading figures at the Myanmar's government, such as, "We cannot accept useless people in our country." Now, the upcoming campaign shows that anti-Muslim rhetoric remains actually prevalent in the Myanmar's government game. There is no danger for the dominant culture political parties to speak against this minority population of the Rohingya or Muslims in general. They have no mainstream political representation, and they are often discriminated against when applying for ID cards or jobs. How this population has actually suffered during the global pandemic. In studying actually the human condition of this particular population, there is a lack of information, a lack of resources besides being prosecuted. The pandemic has heightened the situation in terms of lack of access for food, and the spread of the coronavirus is underreported in this refugee space. Almost half of the refugees are under the age of 12, receiving less and less education during the global pandemic, making the situation even more worse for them. This is also combined with the monsoon rains that create further displacements for this refugee population. It is obvious that the unhygienic conditions rise as the potential risk for the rapid spread of the coronavirus disease. There is inability to self-isolate if diagnosed with COVID-19, and there is a pre-existing prevalence of the acute respiratory infection that suggests that the environment is conducive to the spread of COVID-19. An overcrowded living condition prevents the refugees from social distancing or from isolating. Limited access to soap, basic need, which is a basic need in order to help prevent the transmission of the virus. The health infrastructure is already burdened, and the human resources and space would be required to treat severe cases or large-scale outbreaks of COVID-19. More importantly, there has been a blockage of telecommunication in order to disseminate accurate messages about the COVID situation, which led to further and further misinformation, such as so for this particular refugee population, the misinformation was widely spread when they actually were told that they will be executed if they test positive for the coronavirus disease. Yep. So when they are actually seeking a treatment during the global pandemic, they are doing so at pharmacies, followed by 35% of health providers in camps. Other engaged in other mechanisms of sale assistance to manage pay for health-related issues. They try to go to hospitals for treatment, but they only get medicine, the same medicine such as paracetamol. According to an refugee international organization, this refugee crisis continues to be heightened during the pandemic. The concentration of refugees is 4 times larger than New York City, leading to very little room to not only social distancing, but to the widespread of false information and fake news about the virus. How is actually the refugee population trying to handle that? Many actually citizens or many refugees are fearing the violence and prosecution. Some of them are escaping throughout the sea, taking risk journeys during lockdowns. Many actually women and children were trying to flee, but then they were faced by smugglers and people who have threatened their lives. They demonstrated forfeit by actually trying to cope in camp activities, such as consultations, infrastructure works, trying disaster preparedness and response on their own, and trying to engage in discussions that solicit appropriate feedback for specific groups or people that are diagnosed with the COVID-19. Now, especially for people with disabilities, this type of participation, which was initiated by the Rohingya refugee population, anchors the humanitarian response accountability to the crisis-affected population. Now, since many of these refugees fled to Bangladesh, which leads the humanitarian response, the enabling of a diverse range of humanitarian and developmental partners to strengthen protections and solutions to this refugee that deliver food, sanitation, water, and the proper health services. The people of the Rohingya refugee population is trying to take self-initiative to assist themselves in collaboration with host community populations and various stakeholders at an international level. However, the challenges continue to persist. This refugee population continues to suffer in areas of displacement and in their home country by the Myanmar government. The global health crisis caused by COVID-19 has even impacted the humanitarian service, which why they actually have taken initiative to encourage physical distance and other hygienic practices that would work for their communities. There were lessons learned that improve the humanitarian operations to be better, to save lives. However, as we mentioned before, diagnoses with coronavirus remain underreported in this refugee spaces. Because of the lack of the internet, it is very easy to perpetuate rumors. Now, there are actually important questions when I conclude my presentation. What is stateless? And does statelessness legitimize savageness exercised by members of the dominant culture? Is there an ethical communication that would define or justify ethnic cleansing? What is legal? What is ethical? What is structural racism? And why has the Nobel Prize Committee not revoked the award from the president of Myanmar? Those questions about national identity, racism, structural racism, discrimination, ethics, and inequality remain unanswered for me, and I am in the process of exploring these rhetorical questions. Thank you very much.